Good day everyone, I am Ala Rosemary Santiago from the High University of Science and Technology under BSNCC. And here I am today to perform the Nasogastric tube feeding, so let's start first with the assessment. First, let's assess the doctor's order, client's level of consciousness and level of knowledge and understanding, availability and functionality of the needed materials. Also check for any clinical signs of malnutrition or dehydration. For allergies to any food in the feeding. If the client is lactose intolerant, check the tube feeding formula. Notify the primary care provider if any incompatibility exists. And now let's move on to the planning. Before commencing tube feeding, determine the type, amount, and the frequency of the feedings and tolerance of the previous feedings. Prepare the equipment such as correct type and amount of feeding solutions, 60 ml catheter tip syringe, a massive basin, clean gloves, pH test strip or meter, large syringe or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube or refilled bottle with a drip, chamber, tubing, and a flow regulator clamp. Also, measuring container from which to pour the feeding if using an open system. We also need a water, 60 ml unless otherwise specified at room temperature, feeding pump as required. And for the implementation, the procedure, prior to performing the feeding, introduce yourself and verify the client's identity using agency protocol. Explain to your client what you are going to do and why is it necessary, and also how they can cooperate. Inform the client that the feeding should not cause any discomfort, but may cause a feeling of fullness. Perform hand hygiene and observe appropriate infection control procedure. Provide for client privacy this procedure if the client desires it. Tube feedings are embarrassing to some people. Assess tube placement. Apply clean gloves. Attach the syringe to the open end of the tube and aspirate. Check the pH level. Allow 1 hour to elapse before testing the pH if the client has received a medication. Use a pH meter rather than pH paper if the client is receiving a continuous feeding. Follow agency policy if the pH is equal to or greater than 6. Assess residual feeding contents. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. Administer the feeding. Before administering the feeding, check the expiration date of the feeding. Warm the feeding to room temperature. The rationale for this is an excessive cold feeding may cause an abdominal cramp, and we usually do avoid that. Clamp the feeding tube. Clamp the feeding tube before all the water is instilled. Rationale, clamping prevents air from the entering the tube. Ensure the client comfort and safety. Secure the tubing to the client's gown. Rationale, this minimizes the pulling of the tube, thus preventing discomfort and dislodgement. Also ask the client to remain sitting upright in a fowler's position or in a slight elevated right lateral position for at least 30 minutes. The rationale for this is this position facilitates digestion and movement of the feeding from the stomach along the alimentary tract and prevent the potential aspiration of the feeding into the lungs. And last, for the evaluation, evaluate the patient's response to the procedure, document the procedure and other important data on the client's chart. Thank you for watching.
Travels. Visual arts. Makeup ideas. Nursing procedures. Life journeys and lessons. Like, notice, subscribe.